julep, julep, julep.
Today, I am so thrilled to have Captain Andre Dorsey from the Newport News Fire Department with me to dive deeper into further opioid safety and overdose. Captain Dorsey, thank you so much for taking the time out of your incredibly busy day to be with us. Thank you. Now, before we get going, please tell our listeners a little bit about you and about your department.
All right. Thank you for inviting us on behalf of the department. Obviously, I'm a captain with the department. I've been with the fire department for 29 years as of next month.
Congratulations.
So I finally made that senior list. We have a wonderful department. We're steadily growing. We're steadily improving with community engagement and trying to make sure that the community is very aware that we're out here and we are here for them. Every day, Chief Rogers and our current administration, we are constantly trying to find new ways to improve with different things with the community, how we can engage more with the community and just become more involved in everything. Currently, I'm assigned to oversee our community health program. That entails our community paramedicine program, our care program, which is for our mental health patients that we encounter in the city. We have a mobile health initiative that will be online before the end of the year. And we currently oversee our own pharmacy needs for the department for our medic units. We have 12 frontline medic units, and we have that run out of 11 stations, a host of specialty teams, other initiatives, and again, so much community engagement that's going on, so much more than when I first started.
Well, that's great because you're going to reach a lot of people today, so we appreciate it. Now, we had talked about in a previous episode, opioid overdose deaths are down in 2024 in Virginia, 43%, which I was blown away by that number. But last year, over 20,000 ED visits and over 30,000 EMS calls were related to overdoses, which is a huge number. Now, that was statewide. What does it kind of look like in Newport News?
So in our city, luckily, it varies. We're not inundated with opioid calls, but we're no stranger to them either. We do have some opioid overdoses that occur in the city, and we work very closely with our care team, with our health department, with the local emergency rooms to just make sure that we're doing everything we can to reach everybody out there.
So how often do you get, even if it's not opioid, but overdose calls, do you think, in our area?
Good. I'm sorry.
Okay, we're not going to ask that question.
So, yeah, we'll cut on that one.
Okay.
I'm just trying to think of
I know when I tried to look up like a stat, it was.
It's not. It really varies, and I know that's not a number. I asked one of the field supervisors yesterday, and it was like, yeah, it just kind of varied.
So how typical are overdose calls in Newport News?
So fortunately, in our area, they vary. It just depends. If there's some illegal narcotics that have been introduced into the neighborhoods, then obviously that will increase the overdoses. But if that doesn't happen that often, then those cases still vary. What we are more concerned about are the overdoses from a lot of your prescribed, not necessarily opioids, but your prescribed medications to a lot of our seniors that are out here that are now dealing with dementia, Alzheimer's, and a lot of them who are alone, who don't have caretakers in their home, that, they have to self-prescribe their own medications. And that's more prevalent, it seems to be, than a lot of the illegal activity, narcotic overdoses.
Okay, great point. So when you look at some of those prescribed medications, and some of them are going to be opiates, what other substances are oftentimes involved?
So outside of your illegal opioids, a big one is when you're talking about overdoses, that category is so broad.
Sure.
So if you're talking about alcohol overdoses, you're talking about, again, prescribed medication overdoses, illegal activity overdoses. It's just so many out there, almost too many to name. But what we kind of pride ourselves on is just making sure that our employees are trained well enough to be able to identify them, address them, assess them, and then transport them if needed to the local emergency room so that they can further handle them.
And you brought up something that's important at the overdoses can be related to prescribed medications, but then in combination with
Mhm.
other things like alcohol or recreational drugs in
Yes.
combination with that. So that's super important for our listeners. And when we talk about overdose risks, I don't think a lot of patients appreciate how their medical status plays in. So, I'm an interventional pain doctor and I take care of a lot of people who are at the back end of life. And so we're talking, COPD,
Mhm.
coronary artery disease, some early dementia, lots of vascular problems. And so when their medical status changes, their response to the medication is not the same. And especially when you add like sleep apnea, heart
Mhm.
failure, that kind of thing, where all of those depress the respiratory system and make them more susceptible to those side effects. So for patient, but
Mhm.
also for their caregivers and loved ones, what would be signs for them to look for of overdose?
Um, a lot of your basic signs are you've already mentioned decreased respirations, some abdominal pains, um, some difficulty breathing, depending on what the combination of drugs are. A lot of, I've already mentioned difficulty breathing, possibly they become diaphoretic, heavy sweating. Um, Ultimately, depending on what the mix is, then you're looking at a loss of consciousness, and that's what we want to try to avoid any of it. But obviously, that loss of consciousness is when it's really getting into the bad end of things.
So, going back kind of more specifically with opiates, if someone thought that they had overdosed or they thought that their loved one had overdosed, how should they respond? What should they do?
Start by calling 911. That's not in. We don't feel that that's a poison control issue at that point. A lot of folks won't be able to identify what the difference is.
Mhm.
So start by calling 911. That'll go ahead and that will have your local, not just here, but typically wherever you are, that'll go ahead and get your emergency folks rolling towards you. Then after that, your dispatchers, they'll kind of talk you through it as a caretaker or caregiver or family member. They'll talk you through whatever's going on. You want to make sure that you try and locate said pill bottle if we think that's the issue, or even if it's some remainder of some type of illicit drugs or anything like that. We want to make sure that we try to find all of this so that we can, once 911 responders get there, you can hand it off to them so that they can get it to the emergency room with the patient.
Now, in Virginia, if you are getting a certain amount of opioids or dose of opioids, and definitely if they're being prescribed concomitantly with other respiratory depressants, gabapentinoids, benzodiazepines, which they really shouldn't be prescribed concomitantly, but they still are, your provider is required to prescribe Narcan.
Mhm.
And so I have lots of patients that have it at home, but I have a lot of patients that are resistant to picking that up. They don't
Right.
want someone to, they're like, Doc, I don't abuse my
Right.
medicine, that kind of thing. Um, what would you say to people when they have that hesitancy to have it at home?
Um, I really think it's imperative that anytime that you are offered, not necessarily offered, anytime that you're prescribed an opioid, that you also receive education on the Narcan, as well as you should be issued the Narcan for you or for a family member to be able to take home so that you have with the patient and the medication together. They are to be able to utilize in cases of emergency. You may never know. Speaking from the city of Newport News, we're a pretty long city, and sometimes we get really busy days. So it may be, unfortunately, it may be a little bit amount of time before we are able to get to you if you call 911. However, we'll do our best to get there in a timely manner as best we can. But yeah, everybody listening should be able to. I want you to keep that in the back of your mind for the individuals that are, resistant to taking that Narcan.
So,
The over-the-counter Narcan, how you use it is it typically comes in a package. Initially, it was one per pack, but then they realized that in some cases that one wasn't always enough, so they start including two in a pack. Obviously, you want to open the pack up. There's some type of seal on it. You want to go ahead and remove that seal, and then there's a point that you want to take that piece and insert it into the individual's nose, and then you should be able to push it up. It's sort of like Flonase.
okay.
You want to be able to push it up and inject it into the individual's nose. Go ahead and remove it, give them a few minutes, and see what happens. Instructions are always on the package. If you feel uncomfortable doing so, 9 times out of 10, the 911 dispatchers will guide you through it, and they will ask you if you have Narcan located nearby. In some other cases, before you leave the doctor's office with it, you want to make sure that you go over with a nurse or with a doctor of how to use it as well. Then that way it can kind of be fresh in your mind a little bit.
And an important thing for people to realize is you're not going to hurt anybody with Narcan.
Correct.
The most you're going to do is make them have some pain, And so if your loved one has altered mental status, but it turns out it's because they have a urinary tract infection or something like that, and you used the Narcan, you didn't hurt them, you didn't
Right.
make things worse, you just made them, maybe reversed some of the pain relief they had gotten from it. So it's okay, use it instead of waiting.
Correct.
Now, in Virginia, your prescriber, if you're getting an opiate at certain levels, and whenever it's prescribed concomitantly with other sedating medicines, particularly sleep medicines like Ambien, the gabapentinoids, and then benzodiazepines as well, they'll have to give you a prescription for Narcan. And I get a lot of patients who are hesitant to have it. I have a lot of patients who are very diligent, and they get it, but they're hesitant to have that on hand. They said, listen, I don't overdose, I don't abuse my medicine, I don't party with this stuff, I don't even drink. And so what would you say to those people who are a little hesitant to have it? Is it imperative that they do, or can they just kind of back off and see what happens?
Yeah, we feel that it's imperative that anytime it's prescribed, that the doctor's office should, if it was up to us, that they should issue it along with the prescription as well. It's not necessarily something that would be a waste of time, and we don't want to look at it like that you don't overdose. Most overdoses that do occur are unintentional.
Exactly.
So if for some reason you actually, take a dose and you're taking a second dose because you didn't remember taking the first dose, or you're tired, you're sleepy, there's a ton of ways that we can look at it to where you accidentally overdose. And in cases of an accidental overdose, again, you want your family members to be prepared to help you out while 911 is en route to your location.
That is excellent point. Most of these are accidental, and so, and it's very easy to forget whether you took a medicine or, sometimes patients are in pain and they're not thinking
Yep.
really clearly at the time. So that's great information. So let's talk a little bit about opiate safety for those who do have it in their homes. Our goal is not to have lots of opiates out there, and our goal is not to have a lot of patients on opiates, but we are Orthopedic and Spine Center, and we do huge surgeries on people, and they ultimately do have pain after that, and they go home with those opiates. So how should people, when we're thinking about safety, how should they store medicines in their home?
So the days of old where grandma stored all medications in the medicine cabinet, those days are long gone. I can tell you after 29 years, I've seen medications in some of every place in somebody's home. But theoretically, they should be stored in a safe and dry location. Typically, they should be kept in one location. So if you're going to keep them in a medicine cabinet, let's make sure we keep all of them in a medicine cabinet together. If you're going to keep them in a nightstand, let's make sure that we keep all of them together in a nightstand. If you have children in the house, you want to make sure that they're secure and kept away from young hands. If unfortunately, and we probably wouldn't be having this conversation, if there's some individuals that may have access to your home or in your home, that may be taking them for illegal or illicit reasons, then you want to also make sure that you keep them away from those individuals. Just the two biggest things is just to make sure that they're secure, and that you keep them in a safe and dry location.
That's great. And also, I tell people to, I've had, unfortunately, patients where they get work done on their home, or their kids' friends come or whatever, and all of a sudden their medicine is missing. And you would never think they'd say, oh, no, they would never take it. Well, when people are in a certain mindset with addiction, sometimes things like that will happen.
Absolutely.
So, and then also keeping them, if you're not going to put them in a pill box, keep them in their original container. It really surprises me how many patients will come in and they have multiple different types of pain pills in one bottle. And it's like, guys, this isn't Tylenol and Advil that are very clearly marked differently. So you want to keep them in their original container, unless you're portioning them out for the day. And also, for our older patients or people maybe with some cognitive or physical impairments, if you're keeping them in a location where your loved ones know that mom keeps her pills in this area, so that you don't have things all over the house, like you said. Now, how do we dispose of them? That's always a question. People come and say, what do I do with this stuff? I'm better now.
Rolling. So again, the recommendation for taking the top off and dumping down the toilet, there's not is not recommended. You can go on the FDA website and there is a list of medications that you can safely dispose of down the toilet. We still don't recommend that because a lot of times people will end up getting those confused. So the recommendation is to take them, to put them in either kitty litter or coffee grounds, and then you want to put that inside some type of sealable container, like a coffee can or something like that. And then at that point, you can dispose of them. If another method is to take a ton of them that may be expired or you no longer are using, a lot of your local pharmacies now will take them. Your CVS's, your Walmart's, Rite Aid, unfortunately, is going out of business, but Walgreens, a lot of those pharmacies will take a certain amount a month, kind of like as a take back program.
And that's a good reminder for us to kind of go through our pill bottles and clear them out. And there really isn't a good reason to keep opiates around the house for most people. Some people it is, but for most people, it's not a good idea to have them just kind of sit around the house. And even if you think no one's going to mess with this and no one's going to intentionally take it, there's always that accidental that we want to avoid. So what do you think that we could do better as doctors, or what do you think we should be advising our patients about when it comes to opioid safety?
It's a big one.
Well, you can put us on blast. It's fine. It's all right.
I don't want to put you on blast.
We can take it.
Let's see. The unfortunate part is that some people will have to be placed on some type of opiates depending on what type of surgery they have. It's just, everybody's pain level is different. But obviously, like I mentioned before, I would make it mandatory that if you are prescribing an opiate, then you're also prescribing a dose or two of Narcan in each refill. If there is a refill for that prescription, each refill also gets another dose or two of Narcan. Unfortunately, what I found out in my 8 years of working community health is there's a lot of agencies and organizations that are siloed. That includes the doctor's offices from your local fire departments. So as long as that list of individuals who are on opioids may be, it would kind of be something, certain health conditions, once the patient is discharged from the hospital, will receive, or typically I do, because I typically handle it, I'll receive either an email or a phone call and say, this is the individual, this is what's going on. And I take that information in turn and email it to our dispatchers so that whenever a crew gets dispatched out to that address, they know what to expect. Ahead of time, you may not always get, just because of our call volume, you may not always get the firehouse. There's help out there if you need it. It's not always about asking. Sometimes we, as the medical professionals, there's a lot of people out there that are depending on us to provide them with the answers and the help and the assistance that they need. A lot of times they're not going to come to us and ask us to say, hey, I need the help for it. If I have a family member that continues to overdose and I just continue to turn a blind eye to it, at some point in time, should the emergency room doctors and physicians that are treating this individual, they should realize that, okay, let's go ahead, have a conversation with the individual. Let's go ahead and have a conversation with the family member to make sure that they have the equipment that's needed, Narcan, and education also, that they have everything that they need to make every valid attempt to save this individual should it come to that. And I think that's what folks need to realize.
Yeah. An ounce of prevention is worth a pound of cure. And knowing what the risks are with these medicines, knowing how to help if you think or suspect a potential overdose is really, that's the key to keeping this down. And of course, with fentanyl everywhere, we talked a lot today about prescribed medications, but unfortunately, with the amount of fentanyl that's out there, you can't take anything without having in the back of your mind that this could be deadly. Yep. And so trying to avoid getting in those situations, but then knowing what to do when those situations occur. Thank you so much. It's great information today.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.